Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about hip pain, the top critical things you need to do now. All right, these are the things that when we get a patient with hip pain, we start going over, these are the things we want you to do at home and to help it, go through basically these 3 steps.
Right, some things that you can control the pain with as opposed to thinking, oh, I need a hip replacement, when in fact maybe it's just how you treat it, and you can manage the pain for quite a bit longer without having that replacement.
Maybe never have it.
Exactly.
So, and if you are new to our channel, which I see a couple people
There they are, Bob.
please take a second to subscribe to us. We provide videos. I like how I pretend like I'm seeing somebody, Brad.
Well, don't tell them that. They don't know.
Okay, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Subscription button here or here. Wander over to Facebook and like us. The Facebook. We're giving away lots of stuff. In fact, we're doing a live video today, Brad.
And we're going to give away.
We're going to give away stuff.
Yep. Okay then.
So, all right, first thing, Brad, we tell every patient is that you need to get that pain calmed down.
Right.
Especially, really no matter what it is, because, as inflammation goes, a lot of things flare up and they calm down again, especially like arthritis.
Right. You have
It
good
tends to
days
run
and
in
bad
cycles.
days.
Yep. So you want to get that, some people start getting pain, they go, this is my arthritis and it's going to just keep getting worse and worse. Not necessarily. Arthritis can get better.
Right.
And so the things you want to do to calm it down, one, very simple, obviously, is you could use ice. Here's an ice pack. You could just go ahead and slip it on the hip here. And
Sure.
woo-wee.
This works nice in a recliner.
Yeah.
Or soft chair, so you got a soft to help support it here. You don't have to hold it with your hand and get a cold hand like Bob is doing.
Especially
right
with
now.
bursitis.
Sure.
A good one.
Yeah.
Arthritis, maybe it won't feel as good.
Yeah, you may need to go with some heat on that, but one way or another, you use
look at me.
some temperature change one way or another, and you may find some wonderful results that way.
Ibuprofen, remember if you take ibuprofen, make sure you eat something with it, some
Right.
toast or something with
Exactly.
it. Turmeric is the natural, I'm not saying it right, turmeric?
Turmeric, I
Turmeric.
believe, but someone in the comment can help us out on that.
All right. The second thing, the second thing of calming it down, this is the one a lot of people don't like to hear, but it really helps to use a walking aid for a short period of time just to calm things down. Brad, are you going to show us how to use it?
Yeah, so oftentimes if your balance is good, you can just use a cane.
Right.
If you're a little wobbly, elderly, perhaps you might go to a walker because you can unload.
We got a 4-wheel walker
Yep,
right here,
yep.
and now you can really unload then.
Yeah, exactly, and if you're a little stable because of the pain, you're gonna be stable with this, plus take the weight as you walk off of it, which more than likely, if walking is a constant irritant, it's more than likely from the weight bearing through the joint. So you can use either or. Again, if you're pretty mobile, the red band here represents my sore hip side, so I'm going to use the cane on the opposite side,
Right.
okay? And you're just going to walk normal, and normal, your right hand goes forward and your left leg goes forward, and then you're going to put some weight through the cane. It's going to unload the left hip, and you're just going to walk normal. This is one of those things that, as a therapist, I usually just tell which hand my patient to use it on, and I say just walk, and usually, without any verbal cues, the sequencing is right because it's just a natural way to do it. If I say, make sure you put your left leg out and your right hand,
I've seen this many times.
then it makes you think, and it becomes very difficult. And
Yeah.
then it's like the heck with the cane.
I've seen that hundreds of times, to be honest with you. So I've gotten to the same point as Brad. We came to the same conclusion. Just tell them to start walking.
And it falls into place.
Now, a lot of people are really opposed to using a cane, Brad.
And a walker's even kind of
so
worse.
you might say a walking stick. You want to grab that white one, Brad?
Well, of course, Bob.
But Brad he forgot to bring it, but he had carved one at home.
Well, I didn't think it's a natural one. It was on my parents' land before they sold their house, and I didn't have to carve it. I just varnished it, put 5
did
coats
you
of
really?
varnish on it, and it's got a natural handle on it where the knot was in the wood. It's really a nice little deal. I'll bring it in next time. You'll see it sooner.
So what's nice about a walking stick is then people just think you're trying to be cool or something. I don't know.
Exactly. Yeah.
Or you can use a cane like an English gentleman.
There you go.
So,
But these, you got some self-defense as well.
but one thing I want to say, Brad, is that quite often that alone calms things down.
Right.
That
Unload
one thing.
unload the joint.
couple more things on to calm it down, or one more thing, Brad. When you're sleeping at night, you don't want to sleep on that hip. I mean,
Your body's going to tell you.
Right.
It's going to say, "Ow, it hurts," and that your body's saying, "Get off the hip."
but it's funny, some people still sleep on it, Brad, even when it hurts.
Well, because they've been sleeping on that side for the last 30 years,
Right.
and it's a habit, so they sleep on it, maybe go to sleep on their back, but during the night when they're not, when they're sleeping, inadvertently they go onto that sore side, and it starts to hurt.
Yeah, you're right, Brad. Things that might help, obviously, is if the painful hip, you try to get it up on top, is what you want to
Sure.
do. Sleep on the other side, and then put a pillow between the legs. It's just going to put the hip in a better position.
Exactly. Typically, most people, it feels good for some reason to have a pillow between your knees anyways.
It does.
Plus, it makes the hip feel better, and you can relax.
And you can lay on your back too, and sometimes it feels better to have a couple pillows underneath the knees.
Sure.
Just bringing the hip up a little bit. It seems to take some of the stress off of it.
Should we show them the
Yeah,
leg wedge?
do we have it?
Yes, as a matter of fact, Bob, I just had a patient about a month ago with hip pain, and I said, "Why don't you lay down?" And I was doing some things, and I said, "Let's just try this." And I did this, and the person went from this to a smile, and they went out that very day and bought one downtown.
Yeah. What's nice about these leg wedges, you just go on Amazon and type in leg wedge, about $25 or
Right,
so. I mean,
right.
and if it gives you a peaceful night's rest, it's well worth it. So
These people, as a matter of fact, they went downtown. I said you can give them $25 on Amazon. They wanted one that night. They paid $50. They didn't care. They felt that good. I'm not kidding you, Bob.
all right, so once we got things calmed down a little bit, we're going to go step number 2. Now we're going to try to get 2 things we're trying to accomplish here. One, to get some motion, and maybe to calm it down with take the pain levels down with a massage.
Sure.
So the first thing, a lot of times with a painful hip, you start to lose motion in that hip because over time it hurts, so you don't move it, and then it gets tight, then it gets tighter, and it hurts more, and then you don't move it, and it's a vicious cycle.
Yep.
And what we have found, or they have found, we didn't discover this, if you can regain even a few degrees of motion back in your hip, it tends to decrease your pain.
Right.
So we're going to show you all the different motions that you can try to gain back.
And plus, it's hard to get your shoes on when your hips are tight because you can't get down there. A lot of functional things make it easier too.
Yeah, so one of the ones that we do first, Brad, I do with most people is, laying on their back, I just start having them do rotations.
Sure.
Now this may look like you're rotating the back, but you're actually rotating the hips too.
And you are doing the back.
Yeah.
You're getting, multiple joints involved here.
If it really hurts in one direction with your hip, just work the other direction and then every once in a while try that other direction again. So, but you can actually then start working your way, way over like this eventually if it starts to feel okay.
Yep. Listen to your body.
All right, then the other one you can start going in is the hip flexion. So you can do this, and we do pressure on, pressure off, pressure on, pressure off.
Right.
And again, you want to do it within a pain level. You don't want to push into the pain to the point where that you're getting all fired up.
Right. Now, one thing, a lot of people may have a sore knee or a replaced knee.
So grab under here.
Yeah, grab under there. You can take a towel roll and put it under here.
Or you could even take that strap. Is that already available, Brad?
Well, of course, Bob. We put it away and it's home. There you go. Grab that.
So you can take a strap like this if you have trouble reaching and pull like this. This is the stretch out strap. It comes with handles like this, and you can pull like this and easily get into that position.
Right. So many times people have problems getting that knee up. If you're older, if you're a little overweight and things get in the way.
A standing way to do it, Brad, is to actually go up to a chair and go like this, and then you can kind of lean forward like this, pressure on, pressure off. So you can do this throughout the day.
Right.
Brad would probably fit better on the chair,
Yeah,
right?
and then it gives you something safe to hold on to. Make sure you take your shoes off, of course, and work that. And work it gently. If it starts to hurt, don't think no pain, no gain, and really wrench on it. Be gentle with it, and it'll work its way through there.
Yeah, again, we're not aiming for pain here.
Hey, we're aiming to just loosen it up in a cordial way.
Next one is external rotation. This is a nice one. Can you do it while you're sitting? Very easy to do. And I always tell people, you can check out your hips. You can put one up, like the painful one, and see how far down it goes. This is external rotation. And then compare it to the other one. And if that one goes down a lot further, now you can kind of see how far you have to stretch it.
As a matter of fact, we can see on Bob his right hip is tighter than his
It
left.
actually is a little tighter.
Yeah.
Yeah. So again, you can just put your hands on here, pressure on, pressure off.
Right.
Pressure on, pressure off. I had a lady, Brad, that she's about our age, 50s. She was in her 50s.
Still young.
Still young. Yep. And she literally could not walk more than 50 yards because of pain in her hip.
Yep.
This is the only thing we had her do.
Yep.
Went away.
There you
Pain
go.
I mean, it was like a miracle.
That's when it's really fun to be a physical
Yeah,
therapist.
that's when it's one of the good times. All right, another one is hip extension, Brad. Now, hip extension you can do, I'll do this up here, but you can do this on the floor, and you put a pillow down, and I'm stretching this one,
Right.
and I'm leaning forward like this, and I'm stretching this hip.
Right. So this back leg, he's getting a stretch right up in here. If you were going to do this, I'll do it on the floor
Sure.
like this, and this is the.
And he's keeping
hip.
good posture. Look at
Yeah.
him sitting up
Yeah.
nice and straight.
We're not doing this, although we did discover
Yeah,
that.
that
one
actually,
video.
that's a different way of
Right.
doing it.
So
Leaning forward.
we're learning something new all the time. There's different ways for different people and whatever. So you'll know the whole idea is if it feels better when you're done and things are
You
improving.
can do it on the bed like this. You can put the hip like this and then lift up like this.
Sure.
This is a great way to do it also.
Right.
Actually, I feel pretty good actually. So,
These are obviously for more mobile people. If you're weak or you're older, some of these are going to be too aggressive. So be safe with them.
all right, that's all the movement ones. And you want to see, especially if one's lacking in one direction, you want to make sure you hit that direction. If there's soreness around the hip, you know, that you can actually palpate or feel, you may want to try some massage. And we got the Pure Wave massager. This is a cordless massager. This is a real nice one. We've done a lot of videos on there. And you can just work that area, maybe work it all the way down here even. It actually feels better.
Yeah, there's the IT band here that is you're connected directly to the hip abductor, and so that whole chain there. You might want to work in the gluteus maximus or in the piriformis, which might be pulling the hip back in an abnormal position.
I was going to say, it's probably a little loud while we're talking, Brad, but that's also the tensor fasciae lata.
Yeah.
All those muscles there.
You wouldn't be doing the standing, you lay down, but Bob's in my way, so.
Here's a cheaper one, or less expensive one, the Nursel massager. Same thing, kind of work the area.
And it works nice too. You know, it has a cord on it,
Yeah,
so
this
it's
one
not
has a
as nice.
cord.
But other than that, you know, for the price, it's a good deal.
Okay. You can also not spend any money and just use like a tennis ball and work the muscle like that. Now this is a lot more aggressive, isn't it, Brad?
Right. This is if you've got a tight muscle or
And you want to massage it like
yeah,
that.
you want to get that tightness out to relax it, to let the joint relax. That's something you're going to have to work with and, you know, be careful with it.
Boy, Brad, I see we're really running long here. Let's jump right into the last one. Last one is you really want to try to do some strengthening of the hip. Because especially if you see someone walking along, Brad, and they're doing this, it's because that hip isn't strong enough, and that's
Right.
putting stress on the hip every step they take.
Right.
So-
That's a pretty common, you'll see people walking like this. That's called a Trendelenburg gait. And the exercise that most therapists are going to give for that is going to be the hip abductor.
Yeah,
Should I
why don't you show that, Brad?
So if you're holding on to a walker or a cupboard base, and this is the weak hip, we're going to do an exercise like this. Out to the side, my toes are not pointed out this way, but pointed straight in front of me, and you do them good control, not this, but this. It's harder to do, it doesn't go as high, but that's the way you want to do it.
Yeah, I would definitely start with those. That's the main one to do. Just do lots of those. And you might do some shallow squats.
Sure.
Ball on the wall is always good for that.
Someone's going to ask repetitions. I would say 10 to 15 repetitions is a good place to start.
I'll do it right over here, Brad.
Okay.
So a ball, or you can do squats without them too. I mean, you can just do squats behind a chair to be safe.
Yep.
But what's nice about this, it really gives you a lot of support. And you can do shallow squats and then eventually work down to some deeper ones.
Right.
But just a great one for strengthening the hip extensors and
Right.
and getting
Exactly.
strong.
Good weight bearing
So,
exercise.
again, we're getting too loquacious, Brad.
Yeah,
We're
wow,
talking too
Bob,
much.
you've been
So-
studying your thesaurus.
So, thanks for watching, everybody.